Supporting the queer community when it comes to physical and mental health only makes us stronger. Providence Swedish's LGBTQIA program focuses on improving access to health care as well as connecting patients to the right resources. Dr. Kevin Wang is back to share more. Welcome back to the show.
Thank you so much.
Tell us what Providence Swedish has planned for this month.
Well, one of the first things we did was we held pride flag raising ceremonies. It's a really great opportunity for us to remember first and foremost Pride in June. It's a protest and it's a call to action. And so to have our program team members really make sure we commemorate and celebrate and remember what Pride is about, I think is really fantastic. We're also marching in the parade, so we're really excited about it. And this marks the second year where we partnered with Seattle Pride to staff their medical tents to be able to provide basic first aid services. So we were at Pride in the Park this year. We're going to be at the parade on Sunday. And to really just let people know they can be taken care of while they're celebrating and remembering Pride.
That's great.
But first and foremost, just remember too, as much as we love June, we love celebrating Pride events, it is something we have to do to support our LGBT plus communities, our community-based organizations all year round. Especially now given the current political climate where there just seems to be an attack on trans youth nearly every day.
Right, and especially when it comes to healthcare. So tell us about the LGBTQIA program and who it serves.
Well, of course, it serves our LGBT plus communities and all of the identities we have from all of the marginalized populations. But first and foremost, our program seeks to improve the healthcare experiences of our LGBT plus communities. So we have Vinnie Fox, who was our system educator, to show our clinics and hospital systems how to have an inclusive environment. We have Maddie Mooney, who was our senior program coordinator for transgender health navigation, and they just help navigate the complexities of accessing transgender healthcare. We now have 2 pilot sites for Providence, Puget Sound, Northwest, and Southwest as they build an infrastructure in Providence sites to be able to do what we did at Providence Swedish. And then we're under the supervision and guidance of our health equity director, Jesus Elizalde Lindgren, and Dr. Ruch Simmons, who is the CMO of our acute care hospitals. But our pilot sites in Providence, I'm super excited about. They're led by Diana Krishna and Kels Lopez de Victoria.
So it sounds really a lot like there's been so much thought, and you mentioned the names of all these people, so they're clearly important to each program. It sounds like it's been so intentional, the process. So if somebody's out there watching and they go, okay, I love that they do this, how do I access these programs?
So the wonders of the internet. So our website certainly has a whole bunch of information on how to seek out services. Our healthcare navigator, Maddie, just does a ton of work. And we have on our website a list of primary care clinicians, specialists who have taken our classes and our courses in having an LGBTQIA+ informed approach, and really to provide that inclusive and welcoming environment.
Can I ask specifically what kind of services you provide?
So we're really thrilled to be able to provide as much as we can given our current restrictions and limitations in our resources. But recently we rolled out an adolescent gender care consult clinic, knowing it is a hugely limited resource in the area. We do have a few patients from out of state who are seeking care because of the bans and restrictions placed on their health care. We're also really excited to announce in Q3 of this year, probably in September or October, we're going to be rolling out a hair removal program only for our transgender and gender diverse patients. It is a very difficult to find healthcare service because it is often required in order for people to access certain gender affirming surgical procedures, especially for our patients with Medicaid and Medicare. So we are going to exclusively be starting off with our patients with Medicaid, Medicare, and those without insurance or who are underinsured, because this is a service they really, really need. And our community asked and frankly demanded us to do it, and we have the resources to do it, so we're thrilled to announce it.
Well, and nobody thinks about that. Like, these are just the things that it seems that Providence Swedish is taking the time to really be thoughtful and intentional about when planning these services out. By the way, you have a new role since you were last here. Tell us all about that.
Yeah, so with the work we're doing at Providence Swedish, Providence has taken note and started an LGBT plus health services program for their Providence Clinical Network, which is primarily outpatient-based for now. And I interviewed and was offered the position for medical director for LGBT health services across its 7-state region. So we're really hoping to utilize the things we learned at Providence Swedish to serve an even larger LGBT plus community in the 7 states Providence serves.
Thank you so much for coming on today and chatting with us, and for everything Providence is doing to support the community. It's been a pleasure talking with you again.
Thank you so much.
Of course. And for more information on the LGBTQIA plus programs at Providence Swedish, go to the website you see right there on your screen.
This portion of New Day Northwest is sponsored by Providence Swedish.